in the industry is hurting at the moment, but those are the people who I guess I am closest to, and if you can try and help people you're closest to, that's probably a good thing, I would imagine.
Yes. Now, Ruben, you have got an isolation dedication. Who's it for?
This is for my dad, who's he's in Hawke's Bay, so we won't get to see each other for a little while. We catch up, a few times a year, but he's hanging down in Hawke's Bay, so I'm sending this to him. I imagine he'll be listening in today. And I recently, when I last saw him, I introduced him to Sharon Van Etten's music, and this is my favourite Sharon Van Etten song. So this one's going out to me old man, and it's called One Day. Yeah, this is for Mel Bonner, my old man.
Sister, don't mind that I'm not on time. She knows that I'm through with that. Sick of trying. Don't let mine. Mama's still love and daddy's still love. They know that I'm here like that. Unlike mine, true and kind. Call me your side and I will now be, and I will be fine with that. You don't leave me now, you might love me back. Distance is fine, I know you can't care, and nothing is big like that. You don't see me now, I don't see you back. One day I'll be fine with that. One day I'll be fine with that. One day I'll be fine with that. You don't leave me now, do you love me back? Just to remind you I'm a mistake. How come you don't want to know? You don't want to see, you don't want to show. Kicking myself, I know that you're tough. Yeah, we can pretend we're that. Gotta see how you gotta leave that.
It's Sharon Van Etten on RNZ National this Saturday afternoon. One day, it was a dedication for Ruben Bonner's father. We're coming up to 1 o'clock. At 1 o'clock, we are having news and we're going to cross live. Sarah Stewart-Black, the Director of Civil Defence Emergency Management, is going to speak along with John Ombler. We'll have all the latest as well as weather. And then after 1 o'clock, I'm going to continue playing your isolation dedications. Some very, very good songs have been picked by you. Prince is in there, as well as Pin Group. I have to play something special for them. And I'll see how many we can fit in. It's been rather overwhelming at all the wonderful feedback and response that we've had to these dedications. Also, coming up, I'm going to play Trevor Reeke's interview that he did down in WOMAD with Jimmy Carter. He's the front man of Blind Boys of Alabama. It's a fantastic interview that's coming up after 1 o'clock too. But taking us to the news, it's quite an appropriate song for Auckland City and I imagine Wellington, Dunedin, in fact all cities throughout New Zealand. This is a song called Unreal City. It's M. Ward off his new album, which is out very soon, called Migration Stories. Here it is.
Good afternoon, everybody. Thank you for coming here on a very wet Saturday in Wellington. We're giving Ashley Bloomfield a very well-deserved day off today, so Sarah Stewart-Black will give a health update, and then I'll give a more general update, and then we'll take some questions. Can I hand over to you, Norm?
Thank you very much. Today I'm providing the Ministry of Health update on confirmed COVID-19 case numbers. There are 83 new cases of COVID-19 in New Zealand, made up of 78 new confirmed cases and 5 probable cases. This is at 9 o'clock this morning. There are 50 individuals that we can confirm have recovered. We have 12 people in hospital with COVID-19. There are 3 in Wellington Regional Hospital, 2 in Nelson Hospital, 2 in Whangarei Hospital, and 1 each in Auckland, Waikato, Taranaki, Dunedin and Greymouth hospitals. There are 2 people in intensive care units, 1 on a ventilator, and for privacy reasons I won't be providing other details on these 2 cases. As Dr. Bloomfield mentioned yesterday, laboratories are working to process and report test results as quickly as possible. Taken over a 7-day period, our average daily test number is 1,613. Anyone who has been tested is expected to be in strict self-isolation until advised of the result of their test. Overseas travel and links to confirmed cases continue to be in the most significant infection path. The combined total of confirmed and probable cases in New Zealand today is 451. Finally, I'd like to reiterate my messages over the last few days and ones that Ashley Bloomfield has also reiterated, and you'll have also seen from local health authorities. Please be kind to each other. Particularly on social media, we're seeing reports of abuse to people with confirmed COVID-19. There's a high level of anxiety in the community, and it's just not acceptable to be attacking people that have been caught up in the pandemic. We want those with the symptoms of COVID-19 to get tested so we can manage this outbreak and recognise the clusters of transmission and stop them from spreading. Please don't make this any harder for people to be able to seek the help that they need to be identified as having COVID-19. We need to look out for each other now more than ever to unite against COVID-19. And as you've heard John say, the weather here is pretty awful, and it probably is in other parts of the country. It's a great day to snuggle up at home and enjoy being with your loved ones in your home where it's safe to be. Please take care of each other and be kind.
Thanks, Norm. So a more general update. This is our first weekend at National Alert Level 4, and we're very pleased with how people in New Zealand have responded this week. And I'd like to thank people for the good stuff that everybody's doing to keep communities safe. These momentous changes were flagged less than a week ago, and it's only 2 days since we've been living a new way of life. We're very quickly adapting to that, and you all will be in your own ways. I have an update from the police. They report that most people, in their view, are following the new rules. There have been some isolated incidents of people congregating. In these situations, people were spoken to and provided with advice on what the restrictions mean. We don't want people congregating at parks and beaches. Keep to the 2-metre rule. It's really important. Don't go swimming or surfing. A walk along the local beach is fine, but don't do anything that may result in you requiring help if you end up getting into trouble. If people believe that others are not complying with the restrictions, I suggest the first port of call is to talk politely with them and discuss it. If it's necessary and people are clearly flaunting what the rules that we want, you may wish to call the police on 105. If it's urgent, there's always 111, but let's leave that for real emergencies. This weekend is very different from usual. It's important for everyone to stay home and save lives, New Zealanders and visitors alike. You might be tempted to leave the house, but you can only leave home for essential reasons and for physical exercise by yourself or with the other people in your house. Stick to your bubble. By all means, go for a short walk or run in your neighbourhood, but don't go to playgrounds or drive to a beach or park outside your neighbourhood. Stay local. Avoid going at distances, tramping, fishing, hunting, surfing, swimming and other activities at a distance from home. Emergency services are needed to respond to the COVID-19 challenge. Please help them by reducing the chance of any other issues. I've heard today that some people were playing touch rugby and frisbee in parks. That's just stupid. People need to stop doing that sort of thing. COVID can transfer on a frisbee from one person to another. With touch rugby, it's quite obvious. Please don't do it. Don't be stupid. Travelling locally means don't travel out of your neighbourhood and go to batches or second homes. Stay in one place. If you're outside your home, keep physical distance from other people. Give them 2 metres of space. And you can only be in physical contact with those in your bubble, those you live with. Avoid public spaces. Don't touch surfaces others may have touched. Local transport, such as buses and trains, are available for people who do not have other options for essential travel, including going to the supermarket and pharmacy. After touching surfaces on public transport, make sure you sanitise your hands. Please remember that domestic travel around New Zealand, outside your locality, is banned except for essential business and essential workers. This means you can't drive or fly or take a bus or train out of town. Just talking about New Zealanders returning home for a moment, we're continuing to bring Kiwis home and have ensured we have the capacity to accommodate those without a self-isolation plan on arrival, and that includes accommodation and food. I've heard about a lack of food for some returning New Zealanders, and that's not good enough, and we're working on it. Hotels are required to feed guests, and we're discussing issues with them, and we are sending the Red Cross to hotels to help with welfare issues as they arise. We now have the ability to transfer international arrivals to their home base via regional flights specifically for their repatriation home. For those arriving at an international port who are able to get home with no more than 5 hours travel by car, they'll be permitted to do so under certain circumstances. Private vehicle, 1 driver, 2 or 3 passengers. Keeping in mind the social distancing requirements, making sure people have sufficient space and distance to transport family members home. There's no welcome home hugs, strict self-isolation upon arrival home, and that will be checked. I understand that for a number of people, separation from family will put self-isolation for 14 days. It's a distressing situation. It's an uncomfortable experience, and we're making every effort to make sure people's needs are being met. As you can understand, getting New Zealanders home during a state of emergency in New Zealand and the wider global pandemic has been an exceptionally difficult task, and it's important to recognise that this is a huge effort involving both the public and private sectors. Just talking briefly about supermarket shopping, no one needs to worry about supermarkets running out of food. The supply chain is working. Try to avoid long lines at the supermarket over the weekend by shopping during the week. Shop for essentials only. Choose one person to do the shopping. If you need one person to drive, leave them in the car until the shopper comes back to the car. 2 people and groups should not be allowed in together. Respect the need for physical distancing. If you're in the line or in a grocery aisle, stand 2 metres away. If someone asks you to allow them more space, please move. Be polite, be kind. Pack your own bags and keep a distance with trolleys. And a big thank you to supermarket and supply chain staff for keeping this essential service going for us. And when you go home from the supermarket, wash your hands thoroughly. PPE, personal protective equipment. We've had some questions about this. We now have information on the COVID-19 website. I'll just show you an example. There's posters such as this one on the COVID-19 website which provide guidance to people in the health sector and across essential services in the community about what personal protective equipment is needed in their circumstance. I'll just read it right across the top though, because it applies to everybody regardless of what the specific need might be in certain industries. This applies to everybody, and I think it applies to everybody in our community. Basic hygiene measures for everyone include physical distancing, good hand hygiene. As we all walked in here today, me and you, we all had hand sanitizer and we cleaned our hands. Thank you. Cough etiquette. If you're coughing, into the elbow. Don't spread it round. Regular cleaning of surfaces and frequently touched items. Avoid touching your face, eyes, mouth and nose. If everybody does that, we'll be in a much better state. So the Ministry of Health recommendations vary depending on what people are doing. Many people, including most hotel workers and maintenance people, many can stay safe by keeping to those conditions I just read out. Others may need some specific PPE. It's clear on the website for everybody to look at and to follow. We're working to ensure that hotels and motels supporting those New Zealanders returning to New Zealand and requiring a place to isolate have the right information and the right access to PPE equipment for the work that they are doing. Remember, for further details, look at the COVID-19 website. And a couple of thank yous. Big thanks to all the essential workers, including health workers, the people who are growing, making and selling food and goods, essential distributors, police, emergency services, transport workers, hotel staff and others. And it's great to see the measures being put in place to keep people safe as well as keeping the country running. Everyone who's staying home, please support essential services workers by respecting all of our recommendations to protect them and you. We're all in this together. Now let's keep up the great work and break the chain of infection of COVID-19. And if you're ever unsure, make sure to look at that website. Just finally, I'll reiterate it, you've heard it several times, it's worth reiterating. Remember the self-isolation rules. If you're sick, stay home, don't go out. Maintain good hygiene with washing hands. Sneeze or cough into the elbow. And while maintaining physical distance, support those who are in need and be kind to one another. And now Norm and I will be happy to take any questions that you may have.
Any details on what cities those repatriation flights will be going to?
I don't have the exact details, but I'll make sure that they've been coming in predominantly, I think, over the last few days to either Auckland, Wellington or Christchurch. I'm not familiar with the exact forward schedule, but we can get that for you if you like.
Is there any community transmission in Nelson? We're hearing there might be.
Norm, have you got any comment on that?
So as Ashley Bloomfield has previously outlined, most cases in New Zealand continue to be linked to overseas travel, but in a limited number of cases the Ministry of Health has been unable to confirm a definite link to overseas travel or to an existing confirmed case, but I don't have the details of those specific cases around the country.
The first case in Nelson in ICU, are New Zealand hospitals ready now to take more cases? Do we have enough respirators? Are we ready to go now with more people?
So I think if I perhaps take that one,
Sure,
that I think there's a lot of interest clearly in both the supplies of personal protective equipment but also in the hospital facilities themselves, and this is why there's this continued exploration about all of the different streams of being able to access both products and equipment to make sure that we maintain what we need here in New Zealand. But right now, the hospitals have been ramping up, obviously, over the recent weeks to be able to cope with any patients needing that kind of respiratory support, including in intensive care beds. So we're continuing the ongoing effort to purchase and make sure that those products are being provided to New Zealand.
Have you got any information about Air New Zealand staff or employees that have been infected with COVID-19?
So I understand that there's a small number of Air New Zealand staff that have tested positive for COVID-19, and that Air New Zealand has been in touch with their people. Air New Zealand will be making a public statement this afternoon on this issue.
New Zealand has said that as told its staff, if they have no symptoms, they're no risk to others. Is that your advice as well?
Can you read that again?
So New Zealand has told its workforce that while they have no symptoms, they are no risk to others. Do you agree with that advice that's been given?
So I think that Ashley's been really clear about the fact that people need to proactively be be careful, be precautionary about the approach. So whilst I understand that New Zealand has an enormous workforce, I think one of the issues we'll need to obviously really be promoting right across all industries and all organisations is the need to be precautionary here. So our baseline advice is, if in doubt, self-isolate. That's the easiest thing to do, but we'll be awaiting to see what Air New Zealand says this afternoon.
Has the problem that was highlighted earlier this week around contact tracing not being able to be done remotely, has that been fixed yet?
So I understand that there is, of course, continued outbound contact tracing, and in fact there is additional resources being brought in to make sure that that can continue to be ramped up. So as far as I'm informed, I understand that's continuing to be increased as the need and the demand increases.
How critical are the cases in the intensive care units?
My understanding would be if they're in intensive care, then they're critically unwell.
With the rollout of the flu vaccine, it seems to be, has it been rolled back? Is that going to put more pressure on hospitals at the same time as the people are in ICU, that more people, like old elderly people, could be getting sick and being brought into hospitals with flu symptoms?
So the start of the vaccination program for influenza has been brought forward this year to prioritise vaccination for those at risk groups, but also health professionals and those over 65. This year's flu vaccine campaign will be the biggest that's ever been provided in New Zealand. 400,000 more vaccines available in 2020 compared with last year. The Ministry of Health and Pharmac have been working with the distributor to make sure that influenza vaccines reach the people who need them most, and that they've reprioritised orders so that every vaccination provider has at least received their first order.
Can you just clarify again, sorry, just missed it. Do you believe Nelson has enough ventilators, a hospital like that?
I don't have the specific information about that, but we can refer that back to the Ministry of Health.
To clarify just quickly how...
Sorry. Are you able to confirm whether COVID-19, how many cases are in Māori Pacific?
I don't have that information, but I can refer that back to the Ministry of Health.
Beneficiaries too?
We'll be able to find that out. Thank you.
Just in terms of the two in ICU, sorry, could you just clarify where they are?
So the information, I don't have the information of which hospitals. I have that there are 2 people in intensive care units, 1 on a ventilator, and for privacy reasons I don't have that information here.
I've got some questions around flouting the self-isolation rules. So there have been reports to stuff around dozens of businesses in Canterbury self-declaring themselves essential, and people are asking, is there any way they can report them? And we've also seen people surfing in Taranaki, and police are dropping little notes on their car, but is that good enough? Should more be done? Can people report them?
Well, as I said before, the first thing I think is that as a community, supporting one another, which and part of that support may be having a word to say, do you realise that what you're doing isn't in compliance with the self-isolation rules? If people don't respond to that, and there's clearly ongoing flouting of the rules, then the suggestion is that people should ring police on 105. But in the first instance, let's just gather together as a community and try to get what we're after. It is vitally important that people across the country follow these rules. We cannot allow person-to-person spread of this disease. It must stop.
There's reports coming out of the UK that not all PPE given to staff meets the World Health Organisation standards. What guarantees do we have here that all of that PPE going to health workers do meet the World Health Organisation standards?
Look, whilst on the specifics of that, I think that's a response back to the Ministry of Health. I think that they have worked with the evidence base to inform their purchase of equipment that is going to be right for this pandemic. And so I think that's really about making sure that they're trying to do their very best to provide that protection for the people that we need the most through this. They're going to need to be fronting the patients that are most critically unwell. So all of the equipment that has been brought into New Zealand is to make sure that we are at that highest standard of protection.
Just on the gatherings and social distancing, do you know if there's been any arrests or formal warnings issued yet?
I know the police have had discussions with a number of people, but I have no knowledge of it proceeding to arrests at this point.
Just going back to Air New Zealand, do we know how or where the staff got COVID-19?
I don't have that information.
What happens to businesses who've secured the 12-week worker subsidy if we go back to work after 6 weeks, does that allowance already in the bank account have to be paid back to the government? How does that work?
That's a question that I don't have the absolute answer to here, so I won't try to answer it, but we can make sure that that sort of question is part of the Q&As on our website.
Update, was there anything about any more clusters at all, or anything around clusters?
So, as Dr. Ashley Bloomfield has noted previously, there are a few clusters, 5 that we know of in New Zealand, and this includes the cases involving Marist College in Auckland, the World Hereford Conference in Queenstown, the Ruby Princess cruise ship, a wedding in Wellington, and people that returned from a trip to New York.
And just on emergency services, so emergency services workers, when they go out to respond to incidents, in terms of this COVID lockdown, does that change the way they approach situations like that at all?
Well, I think the poster that John showed just before is around trying to provide really clear guidance to the range of people that might need to use personal protective equipment, including our front line, and they've received advice from their organisations about how they might need to operate differently in certain situations where they're going into the community.
Are you able to expand on that advice at all?
I think probably look at the poster that's available in terms of that provides quite a lot of information, but we'll be able to provide some updated information from the emergency services maybe at a following media stand-up.
The number of new cases today isn't as big as of an increase as other days. Would you say that it's plateauing now, or have we still got some time for the disease to run before we see that peak?
So from what Dr. Ashley Bloomfield said yesterday, that we will expect to see an increase in cases over the coming days, and I think from memory yesterday he said up to 10 days, where that will give us an idea of how successful we have been. But that's going to rely on all of us really sticking so clearly to those self-isolation rules. It's the game changer. So if we're all able to follow those, actually we will start to see an impact on the numbers. But that's going to be over days and days of continued efforts for all of us.
Kiwis who've returned from overseas are now self-isolated in a hotel or motel. Once their 2 weeks are over, do they have to stay in that hotel until the end of the lockdown? Or how would they, with domestic travel ruled out, how would they get home to their places, or do they stay?
The intention is that for those people you're describing who have been straight into quarantine in a hotel on arrival in New Zealand, that after they've been there for 14 days, we would help them return to their home in New Zealand, where they would remain in self-isolation, the same as all the rest of us, until the expiry of that period.
But if there's no public transport and our New Zealand flights are barely going, how, say they live down south and they're currently in Auckland, how would that happen?
We will make sure that it can happen.
Are there any members of Cabinet or MPs that are currently receiving or have been tested for COVID-19?
I have no information on that.
No.
Community transmission been ruled out for all of those new cases?
Sorry, can you?
Has community transmission been ruled out for all of those new cases still today?
I don't have any information on that. Thank you.
More updates, sorry, the man in the 70s and Nelson, the ICU patient, is there any more information about how he's doing?
I've received no further update today from the situation that Dr. Ashley Bloomfield talked to yesterday.
Yesterday it said that there was a second person not in a stable condition, but they were still in the ward. Are they the second ICU patient?
I don't know that. All I know is that there are 2 patients in ICU.
Frontline workers, health workers in hospitals, a lot of them are trying to self-isolate from their families by staying in hotels and motels. Are they paying for their own accommodation, or is the government helping them?
I don't have information on that, but we'll find that out.
A whanganui company, QSI, that manufactures protective masks, has an alert on their website saying they're running out and they're trying to source additional stock. Is QSI the same company that's making these masks that the Prime Minister says is manufacturing thousands of them? Do you know?
I don't know if that is the same company or not. We'll see if we can get an answer for you on that one.
We'll just go back to the question around community transmission. And Nelson, is there any particular, or do you guys have any particular fears about community transmission down there, given, I guess, the population down there, the elderly population down there at all?
I think we have fears about community transmission right across the country. So this is about making sure that as we're progressing day on day, that we're taking every opportunity to stay self-isolated and be able to provide support to those that are most at risk in our communities.
What's the message at the moment for people who've come into close contact with those 2 ICU patients?
I think, like any case, I think it would be to seek medical advice, and particularly if you've had symptoms. But I think if you're concerned, please seek medical advice. But self-isolate as a proactive and precautionary approach is the best advice in this situation.
Policy for hospital protocol at the moment, so particularly in the maternity wards where fathers have been told they aren't allowed into the areas.
Look, I haven't heard reports of that, but I know that within the Ministry of Health, they're working really hard to provide guidance to all elements of the health community. Of course, there's particular concerns around wanting to minimise risk to a whole lot of at-risk groups, including those that may be about to have babies, but I don't have specific information on that situation.
And this morning the Prime Minister spoke about testing, and she spoke about 3 new areas where they were hoping to get that set up. Can you tell us where that will be and how soon that might be?
I don't have specific information about that.
Sorry. Okay.
We'll just take one more.
One more.
You're
If
done.
no more, thank you very much
Wonderful.
indeed.
Thank you very
Appreciate
much.
it.